So it tells us that electrodes have the ability to vary in size and shape. And that's what we just showed you. Some are round, some are square. Usually it's either going to be round or square now. Older ones were more square and larger, but they'll be round or square. It says an electrode is made from electrically conductive material. That's what the front side will be. The back side, it tells you, will have a housing to inhibit delivery of electrical current when you touch it. So you as the therapist, you don't want to have to touch the back of the electrode on this side, and it shocks you too when you touch the patient and the electrode. So it keeps you from being shocked. So it has material that conducts electricity on one side and material that inhibits electricity on the other side. Okay, so that's the goal. Now, the one thing I will say about this, and I'll show you a picture, is if you're going to be using the electrodes that are self-adhesive, so the self-adhering one, if you're going to be using these, the first question and main question you need to be asking your patient is, are you allergic to adhesives? Make sure you ask your patient that. Because if not, what you can do is create a burn like on the patient's skin, not because of what you did with the electrical stimulation, but because you placed something that they're allergic to on their skin. So you can have an allergic reaction to that. So always ask your patient, are you allergic to tapes or adhesives? It's a good way to just say tapes or adhesives. If they're an adult, by now they would have known. If they're a kid and they're having therapy, chances are their parent would have known. So that's why it's important that you get comfortable interviewing the caregiver or family member that's with your patient, because you want to know things like this before it happens. So sometimes it may be in the chart, sometimes it may not. So not a fun story, it's a dangerous story. But I can remember as a therapist, I was treating a patient for another therapist that happened to be sick that day. So I had a couple of openings on my schedule. This other therapist was sick, they were out, and we had to squeeze some people in. And I had a guy come that was this other therapist's patient. And I was talking to him and interviewing him about what was going on, was reading through the chart. And I was like, man, East End would be excellent. This will change your life. It's going to be excellent. Let me go get these electrodes. So I'm starting to get these electrodes, and I'm putting these electrodes on his shoulder. We're going to treat this shoulder issue. I can't remember if it was pain or if it was weakness, whatever it was. We're going to treat it with East End. We're just talking and laughing and joking. And I go, I don't see anywhere in your chart where it says you have a pacemaker. And I'm just laughing about it. He said, yeah, I do. I said, what? He said, yeah, I do. I got a pacemaker. I got it done. Like, look, you can see the little knot. I go, you have a pacemaker? I go back through the chart. I'm reading. No place is documented this guy's got a pacemaker. I snatched those electrodes off. Get these darn electrodes. You get me sued. You die in here with this darn pacemaker with these darn electrodes on you. So I say that to say, don't assume that everything will have been documented appropriately in a chart. It's your job to treat every patient new, and you do the research for yourself, because you will be sued. The PT will be sued as well if something goes wrong, but you'll be sued also. You want to keep your name out of lawsuits, I promise you. The worst feeling on earth is to have somebody come tapping on your door with a subpoena. You've been subpoenaed. It's a bad feeling. Had it happen once, not because I did anything wrong, by the grace of God. Let me clear that up. I did nothing wrong. I was treating a lady who was suing an insurance company for her injuries. She was suing the guy who hit her's insurance company, and they were wanting to know what was her progress with therapy. So they subpoenaed me here at work one day to come and testify about what I did with that patient during therapy. And so that's a bad feeling. Somebody knock on you. Mr. Winston, who are you, ma'am? Oh, yeah. Yeah. Well, you're the therapist on record. So HIPAA they can subpoena you because you were the therapist on record. Yeah, they sure can. They'll bring you into a law office, turn on a recorder, and start asking you questions. Sweat. The secret is, if you're ever subpoenaed, so in case you want to know how to handle that, what do? You better take great notes. So thank God I actually documented well with this patient. So when they were asking me, Mr. Winston, what do you think about her progress on this date? This was 2.5 years ago. I was like, let me go back to my notes. In reference to my note, what I wrote regarding this patient was this. And I read my note to them word for word. I put no opinion in it because I don't remember this patient. I was seeing 12 to 17 patients a day for 3 years. I don't remember that lady from Adam House Cat. How do I remember that? So just read my note back. Once I was done, I got up and left. I hadn't heard anything since. That was 7 years ago when that happened. So be careful. Okay, so here we go. So we talked about those. Now we're jumping into consideration for electrode selection. That's kind of where we're going. Consideration for electrode selection. So the book tells us there are advantages and disadvantages of each type. The one thing that we're having to deal with is something called impedance, or it's going to be how much interference the electrode produces in relationship to the current that's being delivered. So if you've ever been driving in a car, you were listening to the radio and you went through some trees or something and the radio started to scratch up, you like, that gummit, why is my radio scratching? That static is interference. It's blocking the signal. Your electrode has the ability to block the signal or block the electrical energy coming in from the device into the patient. Instead of calling it static, we call it impedance. So that's what we have to deal with when we're dealing with this. It says these limitations or impedance or interferences may make it difficult or impossible to accomplish the desired clinical goal with a given stimulator if the output is not sufficient to overcome the resistance or impedance of the electrode. So most of these, they've gotten most of these down really low, so you don't have to worry about it, but it is good to think about. Sometimes you have to turn the machine up really high because of the person, or it may be because of some type of impedance. So you may have to make some adjustments. It says the resistance of the electrode, which is listed in ohms, 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 should be as low as possible when doing motor level stim. If the desired effect is comfortable stim without motor response, the impedance is not as critical. So if you're going to use higher amplitudes when you're doing motor stim, so you really want it to be as comfortable as possible. A lot of times when you order them, they will have ohms on them. Sometimes they won't on the actual electrodes themselves, but you can Google the brand name and they'll tell you what the ohms are. So different ones have different ohms, but most of them now have been tailored to patient use, so they are usually pretty good. Yeah. It says if the impedance is high, the stimulator will need to overcome it by delivering more electrical current to the patient. Okay. It says the package of the electrodes may indicate it, which may be lower with large electrodes and higher with smaller ones. So usually the smaller the electrode, the higher the ohms will be. Regardless of the resistance, remember that hydrating it with tap water will sometimes assist in improving the conductance through the skin. So even with the self-adhesive, sometimes using a little tap water with the patient. Most times, like I say, I usually just use tap water after I'm replacing it on the actual sheath that it comes on, so it keeps that hydration already in it. Additionally, and this is the most important thing, skin should be free of oils and lotions. So it's always good to use alcohol prep on your patient before you use E-stim. So, because their skins may have lotions and oils, especially this time of year, people have sprayed themselves with sunscreen or suntan lotion or all kinds of stuff. Sweat, which doesn't sound bad, but it can interfere with sticking. So you want to clean the skin and make sure it's ready. Okay. Yeah. So that's good. We won't go crazy with that. I'm trying to help you. Okay. So that's what I wanted you to know about consideration of electrodes, things that can help it. Okay. Electrode size and current density. Size and current density. So it says current density describes the amount of current concentrated under an electrode. So how much current is actually being pushed out under that electrode? It is a measure of the quantity of charged ions, those electrons, moving through a cross-sectional area. So how much current is actually being pushed out into that area, current density. Electrode size, so 1 inch, 2 inch, 4 inch, or even a 7 to 8 inch electrode. I didn't show you that one. I meant to get that one on the break, but we were chatting, but I'll show you that one. They make something called a dispersive electrode. These are harder to find. It's called a dispersive. So it's a 4x8 or 4x7. It's called a dispersive. So let's hold this up versus this so you can see the difference in size. And then what I'm saying will make sense. So what we were saying, electrode surface area or size is going to be inversely related to the current density or the current flow. So the larger the electrode, the lower the current density. The smaller the electrode, the higher the current density. Okay? It says the total current will be distributed over a larger surface area with the big one, smaller surface area with the smaller one. Why does that matter? So outside of this, and it doesn't give you this, too high of a current or of a current density will cause superficial skin burns. So you can burn the skin of a patient by having too high of a current density. So that's why we want to be careful with that. You can cause a superficial wound on a patient. So that's the real danger of current density, is that I can cause a wound to show up if I'm not careful. Okay. It says electrodes should be appropriately sized for the desired results. We'll talk through that. It says if the treatment was to do forearm muscles, an electrode that was 3 inches would produce a greater amount of overflow current. Essentially what that's saying is you're going to get current that spreads out, not if you know what you're doing. So you want it to be sufficient enough to cover the area to do what it's doing. The only thing that I would be nervous about is using a 1 inch or a 2 inch on really large areas. Like I wouldn't put two 2x2s on a quad and try to do motor level stim with 2x2s on a quad. You're going to cause danger. But on a forearm or a neck or upper shoulders or shoulder or forearm elbows, I'm primarily using a 2x2 because of the size. So you just don't want small electrodes over large areas. unless, this is my unless, well, I won't even put that in there. Just put a star by what I just said, because there is one time when we can do it. Well, I'll go ahead and give it to you. The only way I would use 2x2s on a large area is if I'm using multiple 2x2s. I wouldn't just use 2. I'd use 4. And there's a current that there's a waveform that we can use that uses 4 electrodes and allows me to treat a large area with small electrodes. So there's a very specific current that a specific waveform that we can use where we can have small electrodes, but they're spaced out far enough that they cover a large surface area. So unless I'm using that, most likely I'm going to use bigger electrodes over large areas. So that's all that's saying. Make sure your electrodes make sense. It says, I don't want to go there. So when we're doing it, so we'll do that. So we'll talk about that, being able to get to what we're doing. So coupling media and attachment, that's the next one. Coupling media, what helps to cause? It says surface electrodes require sometime coupling. It could be tap water if I'm using those metal, the metal sponge ones. I may need tap water for those. Even with the ones that we use, the self-adhesive, we're going to use self-adhesive in here primarily. They're going to primarily need some type of coupling medium. You can use tap water for a coupling medium. On some of these, I actually use ultrasound gel. There's going to be a time when I'm going to show you some cool stuff that we'll use ultrasound gel as a coupling medium to treat, to use E-stim. So I'll show you some cool stuff with this. You're going to learn some fun stuff. Pliability of the electrode to confirm to the body part is necessary. So that's why we like self-adhesive, because they can fold and mold around areas. Poor conformity can result in hot spots, delivery of electrical energy. The high concentration of electrical energy over a small area causes what we call hot spots. And these hot spots can lead to burns. Okay? Yeah, so that's what you want to do. So if they're having complaints of significant pain with prickling or very uncomfortable sensation, it feels like it's burning, then you want to definitely turn that down or turn it off. Okay. It says on the right-hand side of 327, the last paragraph before straps, the electrode should conform to the anatomical region to obtain maximal or optimal stimulation. So that's our goal. It says electrodes can be attached using straps or tape or self-adhesive electrodes. And it's the same straps that you use with Jonna's class, those little blue straps that go around. We still have them here. I'll bring them out when we finish. So the book talks about straps. They said they've been commercially manufactured. You can get them from all over the place if you need them. We won't cover straps. Tape, it talks about, can be used to attach it to a patient. Again, I like this Christmas tape. I'd be careful with a lot of different types of tape because tapes can irritate skin. So athletic tape doesn't hold as well. I've seen some people try to use athletic tape. I found that this Christmas tape actually holds better than athletic tape. So I have found that. So, but you can use tape as a way to hold it on so that it can lock into place. Okay. All right. So next, it talks about the leads having, let's see here. Where do we want to go? Yep. Page 328 talked about the leads themselves. We've kind of talked about that. It says the goal with the leads, the jack plugs into the stimulator. So the part that plugs in, we call it a jack. It's the part that's meant to be handled. It plugs directly into the stimulator to help to deliver the electrical energy. It must be plugged securely into the stimulator. So make sure you plug it in till you either hear a click or it goes in as far as it can. So when you're plugging in your jacks, push them in far enough. Sometimes you'll hear a little click, or sometimes it'll just go all the way in. But make sure you don't just kind of leave it on the edge, because that can decrease the amount of energy that's coming out of the stimulator. And if you go to plug it in fully while someone is connected, you'll send a shock through their body. So check that on the front end. Okay. The book then tells us there's different type of electrodes and lead wires, such as our pin tips. They can have all kinds of tips, but mostly tips will be used. Mostly tips will be pretty standard. Regarding maintenance, the book tells us scheduled maintenance of the tips should prevent potential problems. Steel wool can be used to clean the tips. Simply rubbing it over should restore the shiny metal. So we get that done by a company right before you guys come back for the summer. So all of our devices are maintenance professionally. So it's not like we're in here screwing up something. Again, it says the tips must be pushed as far in as possible into the opening so that they make full contact. What does that mean? If I'm plugging in a lead wire, I shouldn't see any part of the metal tip. So if I'm plugging in, this is unacceptable. If I can still see the metal tip, it's not in far enough. Push it all the way in until no piece of the metal is shown. You can either try to direct push, like squeeze, or you can try to twist it on. Twisting is a whole lot easier than just direct pushing. But make sure you push it all the way in where the metal pin is no longer seen and the stimulator is fully connected. Okay, so that's important to do. Okay. Mm-hmm. Mm. Okay. All right. So over on the right of page 329, it says many stimulators devices will have multiple lead wires. So those deal with channels. So a channel is the connection of one lead wire and two pins. So each channel should be able to support one of these. And so your device will either have one channel, two channels, or four channels. So it'll support the plug-in and two pins. This goes into one channel. So when I'm using this one, it only has two channels, the two plug-ins here at the top. You have one place for the jack and then the two pins coming out of that on each side. So just depending on the stimulator that you have. If you are working with the patient and they become extremely uncomfortable with what you're doing, you can use a technique that you probably won't see very much in the clinic, and that's called a bifurcator. Bifurcator. So what does that do? So let's say this is my channel. I have my jack and my two pins, and I have two electrodes plugged in on these. I have an electrode here, an electrode here. Let's see here. Yeah, let me plug these in. So I have an electrode here, and I have an electrode here. Okay, and I'm doing stimulation with my patient. I'm doing it with these two, surrounding the area, we're doing it with these two. My patient complained, oh, it's so uncomfortable. Oh, it's biting. Oh, I can't tolerate it. So to decrease what they feel, I will unplug one of my pins, and I will put in a bifurcator. So I plug the bifurcator in, and now it gives me 2 pins for that section instead of 1. So I can now plug in 2 more electrodes. So I got 1 here, and then I can add a 3rd electrode to this system, and that's going to decrease the current density and make it more comfortable for my patient. Yeah, sometimes I would. If I'm doing, I love trying bifurcators with 2-inch, especially if it's over an area they just can't tolerate it. I'll bifurcate it and just kind of use it over the area. Yeah. So every now and then people will use them. Rarely will you see bifurcators in clinic, but they are cool to have. If you have them, that really will help your patients. You can buy them online. Yeah. So, and it says current density from the lead will be reduced or dispersed while using a bifurcator. That's the goal. We're trying to decrease current density. We don't want skin burns. Yeah, absolutely. So it says neither lead should be considered a ground, but rather part of an electrical circuit. If there's not at least 2 points of contact, the patient will not have electrical stim. So you want 2 electrodes either on the patient or somehow 2 electrodes connected to the patient. Whether that electrode is connected to you and the patient and you touch the patient, or whether the electrode is connected directly to the patient. It has to have 2 electrodes connected so that the patient can receive electrical stimulation. Okay. All righty. So now we'll get into setups. This is where it gets fun. How do we set up? This will lead us into our first lab activity, kind of, sort of. Well, second of the day. So, channel technology. So, the book tells us on 329, electrodes down at the bottom. Electrodes are applied to the surface of the skin. We call those transcutaneous electrodes. That's what we use. We use transcutaneous. We go into the surface of the skin. Percutaneous are enter the skin. That would be like dry needling. We don't use percutaneous. Now, here's my thought. For those of you who are like, I'm getting cheated, I'm PTA and I don't get to do dry needling. Let me help you. If we can get far enough through this class, that's the goal. If I can teach you what you need to know, so write that in the box in your mind. Need to know. That's what I have to address first. If I can teach you what you need to know, I promise you, I will teach you a way to use E-stim that's just as, if not more effective than dry needling. I guarantee. You won't need that $10,000 class. You can use that $2,000 E-stim device and get the same results. I promise it. We got to go through need to know. But if you can get through need to know, I'll teach you some really cool, nice to know stuff. And it's going to be fun. So first need, next nice. So if we get through need, I'll get you to nice to know. And you'll be like, oh man, this is fun. I didn't even know you can do this stuff. It's really cool. Okay. So we use primarily, again, transcutaneous electrical nerve stimulation, not percutaneous. And you can be just as effective, I promise you. You can be just as effective using transcutaneous if you know what you're doing, if you know the purpose of why you're doing it. That's why I teach this class so specifically, because knowing how to use E-stim effectively can be the difference in you getting people better or them just kind of mediocring along and going, this sucks, I'm wasting money. Okay, so it's really important. So we use transcutaneous, not percutaneous. Okay, so terminology for configuration. This is what we're talking about. So there's 4 different terms that go with electrode setup when we're dealing with it. The first one is monopolar. Monopolar. The second, bipolar. The third, dual bipolar or bipolar bilateral. And then the fourth one is called quadrupolar. Quadrupolar. Okay. So let's talk you through all of these. Monopolar. Now, this is where students always get this confused. They hear the word monopolar, and the first thing they think is, I only have one electrode connected to my patient. So I only have this. That's it. The other one, I don't care where it goes. It's just floating around in space. I just have one electrode connected to my patient. Does that seem like that will work? Why? You got to complete the... So there always has to be 2 electrodes connected to a person to complete the circuit. Always must be 2 electrodes connected to a person to meet the circuit. Monopolar simply means I have one electrode in the treatment area. One electrode in the treatment area. Not one electrode total, just one electrode in the treatment area. So the picture to the top left here is an example of monopolar. So they're treating lateral epicondylitis. So they're on the lateral aspect of the elbow over the muscle bulk there. So they're treating lateral epicondylitis. It's one electrode on the forearm here. So the small 2x2 is on the forearm, treating that. And then on the back of the arm, they have what's called a dispersive electrode. The dispersive electrode is always outside of the treatment area using monopolar. So if I'm going to use a dispersive, it has to be outside of the treatment area. So I can put it on the back of the arm. I can put it on the trunk. A lot of times I use mine on the trunk. I'll put it on the lateral aspect of the trunk, like going around the abdomen area, or on the proximal hip. I kind of want areas where there's fat content, because if I have more fatty content, then I'm able to increase my amplitude on my treatment electrode enough to really get my treatment done. So I'm either doing it out of the area in a large surface area or out of the area on the trunk. So monopolar. Now, this setup is good for pain, trigger points, IFC. So, monopolar. All right. So, monopolar. I would use this for pain, trigger point, IFC. Not IFC, iontophoresis. What I wouldn't use, or I guess I could use it for motor. I don't love it for motor. No, I don't. I don't love it for motor, so no. Pain, trigger point, IFC. I could use a monopolar. And yeah. Really? Huh? No, IFC is different. I don't want to, let me scratch this. Take that out for right now. I could use it for that, but primarily, the things I'm primarily would use monopolar for. Trigger point, iontophoresis. So scratch pain. We can for pain, but when we talk about pain, the goal about pain a lot of times is we want to surround the treatment area. So I don't like it for motor, and I don't like it for motor or general pain. Trigger point, iontophoresis. Sometimes we can use it for wound care if we're doing wound care. So those are things for monopolar. Trigger point, ionto, wound care. So if I'm doing that, I like those three things. I like a monopolar setup. Something over the direct area I'm treating, and then a dispersive that's out of the way. That's what you want to think. So something over the area, then a dispersive that's out of the way. The next one is going to be called bipolar. Bipolar. This is going to be 2 electrodes in the same area. So this one in area, one out of area. So bipolar, I'm having 2 electrodes in the same area. Picture 2 is an example of a bipolar setup. Bipolar setup. That's picture 2. In your book, if you're looking, page 326, figure 12.3 and 12.4 both use bipolar setups. Bipolar setups. 2 treatments, 2 electrodes in the same area. It can be used for all things. So, usually except, you can even use a little bit for ionto, but most times we don't, I don't want to limit it. It can be used pretty much for all things. We can even ionto in the same area. I don't like it, but you can. It's not a whole lot of stuff that bipolar can't be used for. Pain, it can be used for. Motor is primarily used for motor. We love bipolar for motor. Trigger points, we can do it for that. Ionto, we can kind of keep it in the same area. I don't prefer it. I kind of want the dispersive out of the way. Wound care, we can use it for that. So it can be used for a little bit of everything. The only thing I don't want to use it for is stimulation of large areas with small electrodes. So I don't want to be using 2-inch electrodes on a quad. So they have a bipolar setup, but they're using 4-inch electrodes on the quadriceps. So I just don't want large area stim with small electrodes. That's dangerous. So that's monopolar. Then we have bipolar. Next, we have bipolar, bilateral, or dual bipolar. So what does that look like? That's going to be, let's put dual bipolar. It's going to be 4 electrodes from 2 channels. Or it could be, I guess it could be 1 or 2 channels. So you can use a bifurcator, but we'll just call it 2 channels for now. 4 electrodes from 2 channels, and they are not crossed. So what does that look like? So if I'm using my back, so this is my electrode, this is channel one electrodes. These are channel 2 electrodes. The electrodes are not crossed. They're going to go either like this or like this, but they don't cross across. So they can go vertical, they can go horizontal, they can't cross. Dual bipolar. I have 4 electrodes in one area and they're not crossed. So okay. So if you're looking in your book, if you're looking in your book, look on page 331 and look at 331D. So there you see electrodes from 2 different channels. One channel is on the left side of the neck, one channel is on the right side of the neck. So they're not crossed. One's on one side, one's on the other. They're vertical origin. One's up top, one's at the bottom. One's up top, one's at the bottom. That's dual bipolar. To be true quadrupolar is going to be 4 electrodes from 2 channels, and they're going to be crossed. 4 electrodes, 2 channels, and they have to be crossed. So if I'm drawing them, so this will be channel 1 electrode, this will be channel 1 electrode, this will be channel 2 electrode, this will be channel 2. So if these were my electrodes, I would connect channel 1 with channel 2 down here. It's crossed over. And I would connect channel 1 with channel 2 here. So they're crossing. So it's going to make an X-like pattern when I connect. That's called true quadrupolar. This is usually specific to one type of waveform that we use. Now you can use it with any waveform, but it has to be done with one type of waveform. We'll tell you what that is. If you're going to use this waveform for treatment, it requires a true quadrupolar setup. You can do quadrupolar with anything. So with this picture, would that not be? No, so when you look at it, it looks like picture D. No, because I think the way that they're trying to show, picture C would be that. So you can see the red lead, I think it should be crossed. Yeah. Hang on. Trying to look to see what they have going on. So usually you'll have one red and one black. Yeah. So Okay. Yeah, so you have black, red, black, red, opposites. It's hard to tell where they're running. But here on this picture here, on the one that's on the board, this one would be quadrupolar. So what they have here on the board, that's why I put that picture up there. Here on the board, you have electrode here that's black. They have it running, going across, showing you that it's connecting with the electrode here. And the electrode here is going with this one. So they're truly crossed. Hold that thought. Wrote that wrong. So channel one, this would also be channel one, CH1. So they're crossed like that. I wrote the wrong thing. CH2 would be CH2. So that's the way they would do it. Yeah. I wrote that wrong. My apologies. So make that correction. So channel one would go across like this. Channel two would go across like that. And the two channels form an X. Yeah, that's the way it should be. Yeah, so I wrote that wrong. Pardon my zeal. So that's channel two running like an X. It's coming across. So a red and a black. And then channel one, red and a black, is running like that. And that forms an X-like pattern. So they're going to run an X where most of their concentration is going to be right here in the middle for their treatment. So you're trying to center it in the middle. You're trying to center what you're wanting to actually do the most effect on right in the middle of your electrodes. So channel one, channel two. That's true quadrupolar. Yeah, so the one on the board is the way it should look. That's what I was trying to say. So channel one, we don't know where they're plugged into, but we'll call this one and this one channel one. So you see them running together, the black and the red. Channel two, black and red running together, and they're crossed. Okay, true quadrupolar. So I have monopolar, one electrode in the area, and then a dispersive, which is usually going to be larger than the treatment electrode, is going to be out of the area. So one in, one out. Bipolar, two electrodes in one area. Dual bipolar, four electrodes in one area, uncrossed. And then quadrupolar, four electrodes in one area, and they will cross. They're going to form an X. So they will form an X. Okay? So care, we'll run through these and then we'll give you a break. It says because these represent the point of delivery, the proper care and cleaning is important. The impedance on the carbon impregnated ones that we talked about can be altered if they are dry or they're caked with the coupling mechanism, either gel or water or whatever we're using. So you want to be careful using those. They can be cleaned using mild soap and water to remove anything that's on them. Cracking indicates that it's no longer uniform and that needs to be thrown away. An early sign of electrode wear is a stinging sensation under the electrode that's uncomfortable. Usually that's electrode problem. If there are cracks in those, they need to be chunked out of the way. Hot spots can develop under any type of electrode, but specifically under the self-adhesive ones. It is time to replace the electrode or at least have it checked with an ohm meter for resistance to determine whether the use should be continued if they're having stinging and biting sensation at the initial. So if the first thing they feel is really bad stinging and biting, your electrodes probably need to be replaced one way or the other. So, troubleshooting, always check the skin first, check to see if there's moisture, is there electrode interference, check the size, check the setup. All of these things, if they report they're not feeling anything from the device. The biggest problem I see with students, if someone reports they're not feeling anything, is you're on the wrong channel. So most students who don't do well on the first attempt on this lab practical, they're trying to set something on the wrong channel. So they're on channel 2, and they have the lead wire plugged into channel 1. And so you're trying to do something on channel 1, you're trying to adjust it on channel 2, and there's no electrodes plugged into channel 2. So you have to choose the right channel. That's the biggest problem with students. So if you have something going on, it's probably either you're on the wrong channel or something's not plugged in completely. So that's what I was saying here. Troubleshooting, make sure you have enough amperage. You'll be able to determine that really quickly. Once you turn it up and it goes past 10 or 11, they should be able to feel something. Tingling, prickling, light, they should be able to feel that around 10 or 11 no matter what device you're using. So they'll feel it pretty early. If they feel nothing, you get up to around 20 and they feel nothing, then you're probably either on the wrong channel or it's not plugged in. So always check for that. All right, so that's a good place to take 5. We'll give you a little bit longer. We'll come back about 2:10. We'll get you up and move you around so you don't lose your mind here a little bit. We'll have some fun. So, let's have some fun. All right. into groups of 3. So head to the back. I'll let you choose your own groups, and I'll show you what we're doing. So what you're going to need are these carbon electrodes. These are going to be how you're going to use this part. So you're going to need these carbon electrodes. So grab them off the desk, take them to the back with you. You'll need these.
No, you don't.
All right. You'll need these. All right. Once everybody's back, yeah, so y'all just stand. So three people, and y'all pick a table together, and then I'll assign you a group number.
Oh, we supposed to take these with?
Yeah, you're gonna need those. So yeah, just keep them with you. Okay, so we'll start on the, we always start on the left. We'll start on the right. Group 1, group 2, group 3, group 4. Perfect. I like it. All right, here we go. So what we're going to do is we're going to practice electrode setups, and you won't have full knowledge of it, but I just want to see how well you do thinking your way through these. So I'm going to give you about 5 minutes to come up with how to do this setup using those carbon electrodes in the back. So you can use the tape. So talk your way through it. You can use this tape to glue those carbon electrodes on. And then after 5 minutes, I'm going to call your group up, and we're going to determine if you were right. All right. It's 2:12. 5 minutes here.
I sure cut the machine. Hey, we learned.
So work your way through. All right. Mhm.
Oh, see, we doing some learning this time. That's what's going on.
Practice them all now. It won't hurt. It won't hurt. All right, y'all got about 2 minutes, 40 seconds. 2 minutes, 40 seconds. Work your way through it.
Learning. No, but see,
forces more current density or more current, not current, it forces more current to the treatment area. So I'm getting more current here because I'm dispersing more current here. Well, that's the only thing I was wrong. Everything else I like. Wasn't bad at all. Good job. Thank y'all, gentlemen. Way to go. Good learning experience. There we go. Group 2. Gotta snatch it off. Yeah, you got hairy legs. You're gonna want to shave before this is over. You're a hairy leg person. Okay, group 2, what do we have?
Have 5 set up the elbow flexors.
All righty, so they correctly identified the elbow flexors. I don't disagree with this one. The only thing I would say is I would want a little more space in between them, and we'll talk about that when we start to get into placement of electrodes. When you place an electrode, you want about 2 inches of space, 2 to 3 inches of space in between them, so that the current has more space to go in. So I would go a little bit more proximal. I would maybe move this one up. And this is good. This is showing me that y'all are thinking well. Y'all are a smart group. Y'all have figured out kind of the concept already. So that's the only thing I would do different. Is just move that a little more proximal. I would keep it above the elbow because you're getting more tendon down here in the forearm. So I like the rest of the setup. Everything else is really good. This is a good bipolar setup. They have the right size electrodes. They don't have the overly large ones, which are going to just cover the area so much that it's not going to be effective. So if I had the big 3 or 4 inch electrodes, it's going to be all over the place. Current is going to go somewhere everywhere, and he's not going to get the desired treatment. So good electrode size, good setup. Great job. Excellent job. Group 2. Group 3. Come on down. You're the next contestants on The Price is Right. What we got? Yeah, well, and I'm not gonna tell you. You tell me whatever you want to do. That's why we're learning how to think through it. I just want to see how well y'all are able to process and think. All right, come on up. Let's see if we agree. Come on up, everybody. You can't see them back there, so you don't know if you agree or disagree. This is what learning is. Okay. So, explain to us, group 3, what you have. What's your thoughts? Okay. All right. So, where would your channel be? Very good. That is dual bipolar. I agree. Now, you were saying something very intelligent. What did you just say about it? They would not do what again? They wouldn't fit on the end. So these maybe would be too large to do that area. So what would you go from here if you saw that? How would you proceed? Hot darn. See that plane? That's what I'm looking for.
So we would use like the 1 inch one?
Now you can use the 2 inch. These are 3 inch, so they're pretty big ones. So they're going to not fit with, and plus they're 3 inch circular, so they're really about 4 inch. You have an inch of rubber that even goes around the 3 inch pad. So these are really about 4 inch. So they're just too big. Go ahead.
You couldn't use the self appearance because it allows it to fold.
little strange. So why would you have a 4-inch electrode here and a 2 here? Plenty more in your room. Yeah, plenty more room. Yeah, so yeah, I would probably do that. The other thing that I would do is, so let's get some electrodes here. They're all on the people with back tables. Yeah. So, if I'm doing this, I truly want to be encompassing the lumbar spine. So lumbar spine, if you're palpating, his iliac crest is here. So where is iliac crest aligned with lumbar spine? L4. L4. So if I come across, that's L4. So have I sufficiently covered the lumbar spine? No, because I still have L5 here. So I want to get below L5. So I want to do iliac crest, come across L5, and then I want to go below that. So my first electrode would be there in his trowel. Now here, I will find his ribs. So these low ribs here, okay, that's the end of the ribs represent T12. So T12 here, I come across, palpate there. So I would want my other ones to be slightly elevated. So I would want them to be maybe right before these off, because we want to use them up. I want them to be maybe right about there. So I'm getting the full lumbar spine coverage. Does that make sense? So now I'm getting L1, which is probably here, 2, 3, 4, which we are able to palpate and find, L5. So everything is covered in the lumbar spine. Make sense? Good job. Y'all are doing great. Y'all are thinking your way through some stuff. I'm proud. I really am. So y'all are really, this is a good one. Y'all are way further along than I thought you would be. Okay, so the next thing I want you to do is we are going to determine the capacity of our devices. So you're going to stay in your groups. Each group is going to go through most of these. Well, don't even use the numbers. You can use the names. So this is a Chattanooga Vectrogenesis. This is Chattanooga Intellect Legend XT. This is my favorite baby. This is a Chattanooga Intellect Legend Combo. This is the Intellect Legend XT as well. And then these are going to be portable devices. This is going to be a TENS unit. This is going to be a NIMS unit. And this is going to be another type of NIMS unit. What do I want you to do? You're going to go through with a sheet of paper. You're going to learn. What I want you to discover is how many channels does the device allow you to plug in. So you'll go through and figure out how many channels the device has. That's the first thing. And then you're going to figure out how to plug in a lead wire. So inside of each of these, they have lead wires. Now I'll start with this one because this one is very ticky. And if you do it wrong, you can break it. So, yeah, so I'll show you this one just because I don't want you breaking this one. You gotta be careful with this device because it is really ticky. So the reason it's so ticky, when you turn it to plug in, you'll see here on the side it says stem. What you want to do is it has pins in the machine and the jacks are going to be these actual end devices. So if you just go ramming stuff in here, you're going to move those pins and you're going to tear up the device. Now, to get these reset, it's going to cost us about $1,200. So if you tear this up, I'm going to send you a bill. So be gentle with this. It doesn't matter the number that's on here. I know a lot of people go, well, it's color coded. It says green. These will go into either one. What you want to do is make sure you align it vertical, slowly push in until it doesn't go any further. So be careful with this one. When you're pulling out the jack, don't grab the wire and yank it out. It's not one of those type of things. Hold near the proximal end of the jack you're going to go through all of these, figure out how many channels the device has, meaning, so this one here only has one channel for each thing, or two channels, excuse me. Channel 1, channel 2. So it only has 2 channels. So you're going to figure out how many channels and then how to connect the lead wire to the actual device. So go through and practice with all of these. Then after that, that'll be our day. That should take you about 30 minutes to do that, or somewhere around there, to do all of them. Yeah. So create you a list. Get your some typing paper or something. Create a list. Write the machine name, and then number of channels, and then plug it in. Be gentle. Don't snatch it. Treat it like a friend. Get through these and take notes, because there may be some homework. This is a NIM gene. Intellect NIM.
And we just write how many channels it has, is that correct?
And then practice plugging it in.
You want us to show you plugging them in?
No, I
Oh, okay.
I feel like
Yeah, I bet.
this is also an intellect NIM
That was,
gene.
is that like a new one?
No, well, this one is kind of new. These are for a specific reason that Miss John. Look at how smart y'all are with ultrasound and all this other stuff. See, you walked in not knowing anything. You walked out like, man, I'm skilled. I can ultrasound in the dark. I know what I'm doing. I can take a volumetric measurement in my sleep. Yes, sir. What we do? Mhm.
Wait, then we got one.
Is that the,
This is one for the student. No, no. So that's going to be a patient device to stop and start. Yeah. So, shockingly, this one is going to be out. So you're going to have to read your actual lead to get information on this one. It don't look like two channels, but this says one. This says grab this other side, that goes in here on this side. You put it in like this.
oh, we can do that one. I'm gonna say that this one's probably safe.
Four of those. This is really got that quality in it.
This is the one that I said, because it goes like,
Oh, four.
the one that.
Channels matter. Number of channels matter.
That's the one I'm.
That's my favorite baby.
Mine's right
So.
there, kill mine.
No, we don't think we have any. One inlet, yeah, this is Chattanooga too. Century makes the basic. No, these Chattanooga Chattanooga is in Chattanooga, Tennessee. I went to school. They're just excellent at producing Eastern devices. Like they're one of the premier makers of these in the world. So most people, when they buy them, they last so long. Everybody just buy Chattanooga. That's what you'll see clinically all the time.
Well, how